Okay, good morning everybody. So I'm delighted to have the opportunity to present on the topic of baby skin microbiome. The presentation will quickly recap the basics of skin physiology before delving into the topic of the skin microbiome with a particular emphasis on baby skin and the latest research. At the end, I've included some considerations for care and how a minimalistic approach could be beneficial. So the skin is the body's largest organ and has three primary functions: protection, regulation, and sensation. The stratum corneum is the outermost layer and acts as a protective barrier against microorganisms, chemicals, and allergens. If you compare baby skin to adult skin, babies have a 20% thinner epidermis and a 30% thinner stratum corneum. With smaller corneocytes and less natural moisturizing factor, there's a faster rate of water loss from a baby's skin. This results in a less effective skin barrier function. Throughout the first 12 months of a baby's life, skin continues to develop. The barrier function of the epidermis and stratum corneum gradually increases. We now know that within days after birth, the baby's skin is exposed to a variety of maternal and environmental microbes that rapidly colonize the skin surface. The term microbiome includes the microorganisms, their genomes, and the environmental conditions in which they live. The microorganisms vary between individuals and different skin sites, but also between adults and babies and children. The majority of the bacteria is commensalistic, which means it neither helps nor harms the skin, and it can be mutualistic, which means it helps the skin and benefits the microbes. The latest scientific research suggests that the establishment of microbial communities begins in utero, and this may prepare the infant's immune system for the challenges of the external environment. The first major microbial colonization of newborns occurs at birth, when newborns are seeded with their mother's microbiota. Infants born via C-section are typically colonized by commensal skin bacteria, whereas infants born via vaginal delivery are typically colonized by vaginal microbes such as lactobacillus. Evidence in the literature suggests that these initial differences disappear within 1 month of life. At birth, the microbiota on the skin is homogeneous and not site-specific, unlike adults. The table on the right shows that in the neonate, bacteria is not differentiated by site, as there is no difference in the amount or the types of bacteria present in the nose, skin, and mouth. However, if you look at the mother, you can see that Streptococcus is largely specific to the mouth, Corynebacteria is specific to the nose, and Propionium bacteria is specific to the skin. However, these bacteria begin to demonstrate body site specificity within a few days to weeks after birth. Gestational age at delivery also impacts the skin's microbiome. Full-term infants exhibit an increase in the different types of genre present, and preterm infants have fewer genre present. But within that first year of life, the number of bacteria genre does not change, but the relative abundance of the genre fluctuates. As a child grows from infancy to adulthood, the composition of their microbiome evolves. The healthy pediatric skin microbiome is distinctly different from adults. Similarly, the contributions of these microbes to pediatric skin disease may very well be unique as well. The diagram on the right highlights the changes in the bacteria present on the forearm of an individual over their lifetime. There are many factors that influence the skin microbiota. Some of these include, as mentioned, gestational age, parental skin, feeding type, environmental surfaces and caregiving equipment, and antibiotic use. Early life is a critical period for establishment of both the microbiome and immune responses, with long-term implications for health. Dysbiosis occurs when the skin microbiome is altered from the normal healthy microbiome. It is often present in many skin pathologies, including atopic dermatitis and nappy rash. Damaged skin has decreased bacterial diversity and often an increase in the presence of Staphylococcus aureus. The diagram on the left is an image of healthy skin, whereas the diagram on the right has damaged skin, where you can see the pathogenic bacteria have invaded. As I mentioned earlier, early life is a critical period for establishment of both the microbiome and immune responses, with long-term implications for health. By understanding these modulating factors during this period, it could lead to targets for disease prevention. Over the past 2 decades, consumers have been educated in performing extended beauty and cleaning regimes with numerous personal care products for both themselves and their families. This has led to the skin microbiome being put under severe stress, where excessive personal hygiene will wash away microbes, exposure to preservatives from personal care products can kill the microbes, the pH of products may adversely affect the microbiome, abrasion by rubbing or clothing may remove microorganisms, and natural desquamation, which implies natural shedding of the skin and its microbiota. So what is the answer? Do more with less. Timely and proper establishment of a healthy skin microbiome has a pivotal role in denying access to transient harmful and potentially infectious microbes. The early period in skin development could affect long-term microbiome stability. In adults, sensitive and irritated skin is a rapidly growing problem. We have seen an increase of 25% in the last 20 years, and sensitive skin is more prone to infection. The pediatric skin microbiome is largely understudied, but does provide an exciting area for future research. At WaterWipes, we believe in purity and minimalism, where less ingredients and simpler routines equals less potential microbiome interference. Our product contains 99% water, and our unique 7-stage purifying technology lowers the surface tension of water. These are the results of an internal study where we tested the surface tension of tap water versus our water. A lower surface tension results in a wipe that delivers superior wetting and therefore a deeper clean than tap water for improved dirt, urine and stool removal. These diagrams represent the skin surface being cleaned with either tap water or WaterWipes water. When the surface tension is high, the water cannot reach the dirt in the deeper pores, and a lower surface tension allows the water to reach further into the pores and crevices for a superior clean. The combination of 99.9% water and minimal ingredients provides the ultimate clean that we believe is gentle on the skin's microbiome. I'd also like to take this opportunity to introduce you to WaterWipes Pure Foundation Fund. So as 2020 marks the International Year of the Nurse and Midwife, WaterWipes will be launching the WaterWipes Pure Foundation Fund, which is worth €3,000. And the aim of this fund is to recognise and support excellence and professional development of an individual or team. In the coming weeks, further details will be announced on the healthcare section on waterwipes.com. Thank you. She's
okay. Excellent. Thank you very much. Does anyone have questions? We've actually got time for questions. Just to wait on the wonderful roving mic.
Thank you. Hi. I'm just wondering, the 0.1% or 0.01% In the WaterWipes, what is it? What is in it?
It's a grapefruit seed extract, which is a skin conditioning agent. So it just helps with the cleaning a little bit. Yeah.
Because I was quite interested by that, because that's quite. I've seen it in lots of health food shops. You get it in a concentrate and
the grapefruit seed
clean
extract.
things.
Yeah.
I didn't realise it was in WaterWipes, actually.
Oh yes. Yeah.
Okay. Are there any contraindications or anything?
No. Our product is suitable for preterm babies as well, and it's been on the market a number of years with very low incidence of adverse reaction. Yeah.
Okay, it's fabulous. Any other?
Was the product developed then by dermatologists that had a specialism in infant sort of skincare, or did you kind of see a gap in the market because of the differences in the poorer quality of things like different wipes that are available?
So it was a number of years ago the product was developed, and it was developed by a father whose child had nappy rash, essentially, and he was looking at the wipes that he was using, and he was looking at the list of ingredients on the back of the pack, and he was questioning what is the need for all of these ingredients, and that kind of spawned, I suppose, the development of it. Were these ingredients all absolutely necessary in the product, and could it be done on a minimalistic kind of purity space? So that's where it initially came from.
Research about the water.
Yes.
With the hard, obviously you're changing the water to make it less hard. When did that come about then? And development.
That's
of the
recent
product?
information that we have undertaken. And I suppose when we look at other types of products, like washes or other wipes, a lot of them contain surfactant ingredients that do lower the surface tension, but they need the ingredients to do that. But we haven't added those ingredients to lower that surface tension.
Thank you. There's a question from this lady behind.
Have you tested the wipes against use of plain water in terms of
In terms of cleaning efficacy?
cleaning efficacy and just skin health, I suppose?
In order to commission a test like that, it's a very subjective test, because there's no, I suppose, technical test to do that. So anything you're going to do would be based on a survey response by parents or mothers who use them. So we have done various different types of tests like that, but again, they're very subjective.
Thank you, Emer. In terms of the bigger picture, are they biodegradable?
They're not biodegradable, but it is something that we're working on, and we're hoping that this year that we will have a biodegradable wipe. Yes.
Thank you.
That's the eco issue.
Yeah.
Do you have a warning on the package not?
Yes, not to flush. Yes,
not to flush.
We do. Yeah. It's harder when you want to go biodegradable, because that's a natural fibre. It's harder to still get that purity in the formulation, because you may need extra preservatives to maintain the integrity of the pack. So it is a bit more difficult for us, but we're definitely working on it. We're nearly there.
Because I'm thinking the packs are plastic, aren't they? So it's not just the fabric that's used, but it's the holding.
It is the holding, and that pack is in a special pack that it's sealed airtight in order so it doesn't get contaminated on the inside. Yeah.
So I guess
that's also another thing we're working on.
So WaterWipes, like many other manufacturers, are going to have to be thinking of ways of kind of topping up supply so you reuse stuff, because it's actually quite a challenge that I'm sure everybody's experiencing now, trying to reduce your plastic impact.
Yeah, absolutely.
Right.
Yeah.
Well, it's good to know they're working on it. That's very good. Any other queries? We have another couple of minutes.
If there are any more questions, I'll be out at the stand afterwards. if
And
anybody
that's
wants
where
to
you
come
can
to.
get your sample of the water wipes.
That's it,
They're very,
absolutely.
very nice on the skin, I have to say. Thank you very much.
Okay, thank you.